get ready to take control of your healthcare. Here's your host, Ray Coburn.
For folks that don't know, can you share a little bit about your background and how you started? I understand that you actually started your career in nursing. Is that right?
Actually, I started in health and wellness. So I started in health and wellness and corporate health programs back when that was big, back in the 80s. We did a lot of on-site screenings, a lot of preventive care programs, a lot of screening programs, really focused on the corporate health environment. And so that kind of morphed into occupational health, and that's when I looked at getting into the nursing aspect of it. So I got my nursing license from Excelsior College, and then continued just working in healthcare and continued working in the outpatient setting all through that. I've run programs in rehabilitation, physical therapy, and then also an ambulatory surgery center background too.
If you can kind of just expand on what the Alliance is, and how do you go about facilitating that connection between the various practices, oncology practices, and self-funded employers?
Yeah, so the Alliance is a independent national network. It's got about 50 practices in it that are independent by nature. We have about 900 providers, and we actually are across 29 states. So it is a large organization, and we're structured as a clinically integrated network. And because of that, the practices can stay independent in their own markets with their own governance, their own operations. And then we are there to provide that any kind of additional support they have, additional things that we can provide to them. Like we're measuring some quality metrics. We're out, like you talked about, we're out looking for opportunities to connect those practices. So we've been working with some of the business groups on health, like where we met with the National Alliance, a very important organization in terms of the self-insured employer market landscape in terms of healthcare purchasing. We've worked with regional ones, the Midwest Business Group, the Economic Alliance of Michigan, Employers Forum of Indiana, all the ones that are connected to that. And those organizations are really focused on finding solutions for their employers. And we want to be one of those solutions. So we interact with employers that way through the business groups we work with, also through some of the brokers that we've met and work with. We're actually working on with a broker right now with a benefits advisor to develop more of a product that we can actually bring to market, where we've got a TPA, somebody who helps manage the network. So we're bringing that oncology piece to the healthcare continuum, to the puzzle.
Can you give me an estimate of how much money we might be able to save?
Depending on where the sites of service are, I mean, you could save upwards of 15 to 20%, sometimes higher, depending on if you're really seeing some high outpatient costs, particularly from the hospital side. The physician practice on average, and we use Medicare rates as a benchmark. The physician fee schedule is kind of the benchmark and an industry standard on where claims are based. So an independent physician office can charge anywhere 120 to 160% of Medicare on the physician fee schedule. We've seen claims and talked to brokers where, those fees are sometimes 800% of Medicare.
Wow.
Just incredible amounts of spending. And that's on the service side. And then on top of that, marking up the medications, 5 times the cost of those medications have. And that just doesn't happen in a physician's office. The way the reimbursement structure is, it's usually a percentage of the drug cost, and that's usually about somewhere between 4 to 6 to maybe 8%, which is a lot less than marking it up, 5 times.
Do you have any control over that, or do you curate the folks that you work with, or is it hey, if you're a practice that wants to engage our services, we're here to help you? How does that work?
It's kind of a combination of all the above. We're here to help them, here to make them understand how the process of getting a patient on a very targeted therapy works. There's all the testing that's done, the appropriate biomarker testing, imaging, pathology, all those things go into play. And then usually the diagnosis and all the information points into a certain drug that may work for that patient and their gene type. And then, the physicians then follow pathways or NCCN guidelines or evidence-based care information that really targets down to where those patients are really focused on and really those drugs are known to work. Now, paying for them, I know that's really for some of those very expensive therapies, that's really, a lot of those things are still being determined. But for a lot of the precision medicine now, the Opdivos, the Keytrudas, and those things like that are pretty commonplace in a practice. Many of the practices are large enough, and I think the market has shifted where those drugs can be available. Again, they're targeted therapies; they're not the expense level of the other ones. But we have evidence-based guidelines in place, pathways, and other evidence-based care protocols to ensure that those patients are receiving the right medication for the right patient, for the right time, and the right location.
Again, if I'm listening now and I'm a CEO or a CFO, I'm a numbers guy, and I hear this, that now is starting to paint a picture, right?
Mm-hmm.
Because we talked kind of in the beginning about there's an opportunity for an employer to actually manage this because healthcare is a supply chain, just like any other item that we procure or service that we procure. Typically, there's a supply chain that can be controlled and managed because you can't manage what you can't measure.
Mm-hmm.
But here, if we break down the claims bucket, and we know that 80 to 85% of the dollars spent are claims, and if we further now know that cancer is the biggest bucket in that claims bucket, then it might pay to engage services of an organization like yours to put eyes on it and determine if you are procuring healthcare in the most prudent way possible. And as you know, Robert, with the passage of the CAA, employers now have a fiduciary obligation to ensure that the plan dollars that are being spent are spent wisely, particularly if they're accepting contributions from employees for the coverage. And so that's a huge win for shareholders. And I don't think employers really fully kind of grasp that or appreciate that. Or maybe those tickets to the Masters tournament that the big box broker gives them is worth just kind of turning a blind eye to it. But what I would say is, fuck that. Manage this expense and buy your own goddamn Masters tickets.
That's right. Yeah, because there was a study done recently. I can't think of the name of the study off the top of my head, but they did compare hospital outpatient pricing for infusion versus physician office space for infusion. And over the study period, employers could have saved almost $3 billion. And on the commercial side.
Wait, I'm sorry. Did you say $3 billion with a B?
$3 billion. It was a long study, I think a 5-year study. But just that price difference over 3 years just on the outpatient services, on the outpatient infused drugs, they could have saved that much money by looking at a lower cost setting.
That is absolutely insane. So your organization helps kind of find where the dead bodies are so that an employer at least knows, hey, here's where the overspend is. Here's an opportunity to fix it. Do you do any exercises like that with your members? Is that kind of part of one of the perks or the benefits of membership in your organization? Is that something that you would do with a prospective employer if they were looking at joining your organization? How does that all work?
Yeah, it kind of depends on the relationship. We've worked with brokers to look at different case studies that have been scrubbed of any personal health information. And then it's, that employer or that advisor working with that employer. We've had some employers come directly, but one of the challenges is you've got to make sure that that's very sensitive information so that you're not sharing any personally identified information, that you've got appropriate access to those claims. And I know those are things that sometimes employers can't get. Even though they might be self-insured, sometimes they struggle getting their own claims information back from their TPA or their advisor, who for some reason, doesn't allow access to that. But the most important thing is to make sure you have access.
There are reasons that they're not getting access to that. Let's not even think or pretend that we don't know the reasons.
Yeah.
The reasons are, they're protecting their own best interests.
Yeah.
And, if they're giving that information over freely, well, then there's an opportunity to actually inspect what you expect. And these entities don't want that going on.
Yeah, so I think that's really key, is to making sure you have access to the data, that you can bring in the appropriate expert, which the National Cancer Treatment Alliance can help with that.
All right, that's a wrap. Hit like, follow, and subscribe, and we'll catch you next time.